name is Dr. Jenn with Med Club by Dr. Jenn. I'm here to talk about 3 issues that affect a lot of women, not talked about very often. The first one is incontinence. Even though it's not talked about much, 1 in 5 women over the age of 20, that's 20% of women over the age of 20, have problems with incontinence. And this can happen with sneezing, laughing, running, really any sudden activity. And 20% is a large percentage of the population. Second issue we're going to talk about is painful intercourse. This is an area that a lot of women suffer with. Actually, the majority of women suffer with. And it's just not talked about, and there's no one to really go to talk about. And the third one is inability or either the inability or difficult in climaxing, which is probably the least talked about thing in women. It's unfortunate right now in the culture we're living in that men, it's a discussion point a lot, and if men are having problems, there's lots of avenues for them to go to fix the problem. Where women, it's kind of shoved under the carpet, and even though we might talk to our friends about it, we don't really talk to our doctors about it. All of these issues have a lot of effects. All of them affect our life in one way or another. Incontinence, I guess that one's a little easier to see. As a young woman, incredibly embarrassing to be in a situation where you're laughing or just having a good time. You have to worry about incontinence. And older women, a lot of people discount their issues just because they're older, but it affects women all the same, no matter what the age bracket. Can lead to self-esteem issues, can lead to, isolation, end up leading into depression, have to leave the house, not wearing white or having a pad under your clothes. All these things can lead to self-image problems. And it's really, really very unfortunate. Painful intercourse. With this issue, and it happens a lot of time after women have babies, or after an episiotomy, or even before women have babies, there's a significant portion of the population that just has pain during intercourse. This is an area that is not talked about much and is kind of accepted as, okay, well, if you have pain, you just either deal with it or you don't have sex. A lot of marriages have trouble with this because, after a while, women just get tired of putting up a face or doing something that's not enjoyable, and without any physical interaction, it can really be detrimental to a marriage. Again, this is the area that's not talked about, and as a physician, I know some friends and clients of mine, once they become more friends with me or I get to know them a little better, it comes up and it's just, well, this is just how it is and I have to live with it. And that's super unfortunate, and hopefully today I can educate you on other avenues. The third issue, which is easily the least talked about, is inability or difficulty in climaxing. Women, actually between 50 and 80% of all women have trouble climaxing or have never had a climax. And when it comes to dating, relationships, anything like that, that kind of takes the physical part out for women. And it really can affect your life. It can affect your marriage, just like painful intercourse can. It can lead to self-image, self-esteem issues, and ultimately it can lead to a pretty serious depression because neither of these have, a really good solution. And so it ends up really affecting people's life, and it affects their self-esteem, how they interact with people, social settings. Currently for incontinence, there is 2 main options people have, and that's medication, and the medication has significant side effects. It's an anticholinergic. So people end up having severe dry mouth. They can even end up with urinary tract infections. It's not a very good medication to target the bladder because it has such widely systemic effects. The other option people have used for incontinence is Botox, and it's, I've heard good and bad results from Botox. Obviously, it's a fix that has to be redone every 2 to 3 months, and sometimes it doesn't help 100%. And I guess the other option would be surgery, and sometimes surgery is warranted. If someone's having bladder issues, where their bladder is kind of sinking into their pelvis, a sling might be the only option for them. Or if someone had a large child in utero, surgery might be the only option for them as well, a mesh sling or something like that. But it is very invasive and it has a significant downtime. And we've all heard the commercials about the mesh and infections happening from it. So it's not ideal, but sometimes that's the only option. So inability to climax. Right now there's one medication out, and it's supposed to help women with arousal. While this medication does work for arousal, it doesn't help with the climax part. So, although women are aroused and they're interested in having sex after taking this medication, once they're having sex or, enjoying their partner, they can't really climax or enjoy the pleasure of orgasm. And painful intercourse, as of right now, there is no real treatment for painful or intercourse. Some women are, when they're younger, before they have children, or any kind of surgeries, they still have painful intercourse. And for that, it's just, kind of bear down and deal with it. Or, I'm going to tell you some new things we have out right now. So right now, we have solutions, and I'm really very excited about these solutions. It really can change people's lives, which, helping women, that changes their entire outlook and their self-esteem and self-image. What a gift, what a gift that I feel I have to help people. And I'm very thankful for that gift. So what this new treatment is called the O shot, and it has the ability to treat all 3 things that we talked about. It is essentially, we take some of your blood and we spin it down, and all the red blood cells go down to the bottom and all the plasma stays on the top. And red blood cells, while they're great for oxygenation when you're anemic or anything like that, they don't really help in your body fixing itself. What helps with that is your plasma. In your plasma, you have different components of your blood, platelets and whatnot. Lots of times you'll hear it as referred to as PRP, or platelet-rich plasma. And so when you skin your knee or hurt yourself, you get that scab. But before you get the scab, it has this kind of a slimy coating that's yellow. All that yellow is your plasma coming to the area, and it's using your body's natural resources to fix that area and restore it to what it was, and eventually you grow a new epithelial layer so you have skin back over that area. So the theory on the O shot is this goes into the area and you use the plasma, and the plasma goes to where it's injected, and it naturally fixes what should be there to begin with. So if, for instance, you don't have enough blood flow to your clitoris, it increases blood flow naturally. And so with this treatment, there's no downtime. The side effects are not terrible. Actually, the side effect, for instance, if you're getting it for incontinence or painful intercourse, one of the side effects is increased lubrication and increase, in climax and pleasure during sexual activities. So side effects aren't terrible. And let's see, the O shot, it's relatively new. It's pretty cool. People are using it now in joints and other areas that we're just basically allowing your body to do what it naturally does. We're allowing it to go in and recreate the tissue and restore blood flow of what once was there. And so for incontinence, we've seen a significant decrease in issues with incontinence with women once they have the O shot. Sometimes it has to be repeated in a year or so, sometimes it doesn't. So it all depends on the patient, but there's a significant decrease in incontinence and pretty significant in people's lives. Painful intercourse, there's been a significant level of decrease in pain with intercourse with women who have this issue, whether it's from childbirth or whether it's a natural occurring pain. It does significantly decrease it. It also increases lubrication. So, if you're getting older and just aren't creating the hormones that you used to have to create that lubrication, it helps with that too. We also have a vaginal rejuvenation pack that helps with that as well. And then an inability to climax. Like I said, if you increase blood flow and restore the tissue that was once in your clitoris and vagina, then you automatically have a ability to climax easier and increase sensitivity, which all these things significantly help improve your self-esteem and self-image. So O-Shot is pretty amazing, pretty excited about it, and I hope this video has helped you to better understand these medical issues. If you're a woman in need of help or know of someone who needs my help, please feel free to contact me directly. I have more information on my website, which is drjenn, JENNPB.com. Also feel free to follow me on Twitter. It's at drjenn_medclub. And there's more information, medical tips, and videos online. And feel free to email me. My email is jennguthriemd@gmail.com. That's JENNGUTHRIEMD@gmail.com. Hope you enjoy the rest of your day, and thanks for taking time to listen to me.